right. Good afternoon, everyone. Welcome to the June 29th edition of It's Worth a Shot. Today, we have two guest speakers, and we will be discussing taking the lead on vaccinations in Montana and environmental cleaning and disinfection. I am Jessie Kinsey, registered nurse and account manager with Mountain Pacific Quality Health, and welcome everybody. And next slide, please. As always, just a few housekeeping items. Please feel free to add your webinar topics and clinician ideas or needs into our chat. We'll continue to meet every Wednesday through the end of the year. And I will just add a few comments that we do review the chat and we do review the survey that's posted at the end of the presentation, and take that into account as we build our learning topics. So I know probably a couple weeks ago, someone had put in there an interest for antibiotic stewardship with a nursing home focus. Just want to let you know we listened, and in a couple weeks, stay tuned because we do have that on our agenda as a topic. And then, I believe someone also mentioned some inquiry and assistance needed for vaccine audit resources for employees and vendors. So next week, stay tuned for that, as that is the topic. So again, feel free to put any topics of interest or ideas into the chat, as well as in the survey that we present at the end. We do review those. We are continuing to look at long-term planning of COVID vaccine needs. And with that, I have another polling question. We've done this for the last 4 weeks now, and I've been taking the information on this and building additional tools and resources, and also identifying where we need to build additional tools and resources. So today's polling question, if you guys wouldn't mind taking just a few moments, as we continue to evaluate COVID-19 vaccine needs, what would you categorize as your biggest challenge to either maintaining or increasing your COVID-19 resident vaccination rates? I'll give you guys just a few moments to select, and then we'll end the poll. Again, what is your biggest challenge for keeping those resident rates up? All right, looks like it has, well, a couple more coming in. All right, so it looks like the majority of you, let's see if I can share the results. The majority of folks that have responded, looks like family hesitancy and influence plays a big role. And then looks like a handful of you feeling good about your resources. And then coming in third is access to educational resources that are relatable. Great, thank you guys for participating. And again, we are listening and reviewing, so stay tuned for additional resources. All right, next slide, please. So a question that came up last week, I know we visited it before, and the circumstances weren't exactly fitting for everyone's dynamic, and now some centers are reconsidering this option. Question, how can we become a vaccine provider at our facility? I have relisted all those resources for you if the timing has changed in your center, where this might be an option you want to consider. And I just put it in chat for everyone too. So again, here's the contact information if you're reconsidering becoming a vaccine provider. All right, next slide, please. Wanted to take a moment and extend a special thank you to all of our speakers, our collaborating partners, the attendees that participate week after week and continue to support the needs of our long-term care facilities across our region. And ultimately, I just have to say thank you to everybody, because we have reached out to different state epi offices, immunization units, pharmacies, different providers. And without hesitation, these individuals have stepped up and dedicated time, effort, and expertise. And just want to take a moment and say thank you, and it's much appreciated. Next slide, please. So without further ado, I would like to introduce our first guest speaker, Kyle Austin. Kyle is a Montana pharmacist, farmer and pilot. I think I have that right, Kyle. He's the owner operator of a retail pharmacy, Farm 406, as well as a mobile vaccine clinic based out of Billings, Montana. And many of you listening may be familiar as you've utilized his mobile vaccine service. He provides services statewide in Montana for not only the retail public setting, but also for the long-term care communities. And I also happen to know that he's working on a few details to help start serving the Wyoming community in the very near future. So with that, welcome, Kyle.
Hey, good afternoon, everybody. Thank you, Jesse.
You bet.
All right, so good afternoon, everybody. That's my campaign photo. If anybody knows, I ran for Congress this last primary. Didn't win, but 2024 will come around and I'll get a new photo for that. And we can go to the next slide, please. All right, so like the questionnaire started off, vaccine hesitancy has been a big problem with the COVID pandemic. There's a lot of reasons for that. I fall back and I say it's because of poor education. People weren't educated appropriately on what a vaccine is, what a vaccine does. And then obviously with all the fake news in Facebook and the news out there, it just created more vaccine hesitancy. The fast rollout also had people concerned. It had me concerned also. I waited probably 6 months before I vaccinated myself to where I was comfortable. The fear of needles, that's always been a thing with vaccines. There's a lot of people, like especially your employees out there, that's their reason for not getting vaccinated, is they just don't want to be poked with the needle. And then obviously the politics behind it, you know, and I came back and did a lot of education with folks in Montana. And when it came to the politics, I said, look, it doesn't matter if you were Biden or a Trump supporter, both those individuals got vaccinated at the end of the day. So it's not a political thing. The politics was more of a power struggle out there. The other thing with vaccine hesitancy we didn't put on the slide was people don't like, it seems like Montanans, for instance, they don't like being forced to do something. So some of the facilities I worked with that were more pro-choice on the vaccine, they didn't have as much pushback. So they basically respected those employees' choice on it and then let them finally make the decision where they came around and got vaccinated. Took a little longer, but they got it done. Rural areas. So a lot of the people on this talk today live in rural areas. Montana is one of them. The lack of vaccine availability was huge, just because of the undertaking, the red tape to get the COVID vaccine, and then by ordering by bulk. So a lot of places don't need 100 doses, they only need 6. So that was a big problem in the rural areas. Storage obviously was another one. When they first rolled it out, you had to have a super cool freezer. Now it's relaxed to where you can have it in the refrigerator. And then trained personnel. So a lot of counties in Montana, they have one county nurse and that's it. To get them trained and then for them to undertake a county population was almost impossible. And that's where Farm 406 came into play on helping a lot of these rural areas out. We had a poor distribution system in my mind with the COVID vaccine. It seemed like the powers to be wanted to recreate the wheel instead of using the resources that we have in place. For instance, we have strategic national stockpiles. We have manufacturer distributors like McKesson and Cardinal, AmerisourceBergen, and that were in place already for our prescription drugs. But why didn't we use that same distribution system for distributing the COVID vaccine? So that created a lot of hiccups out there. We had an unfair playing field. That was a challenge, where the corporate favoritism beat out the independents or the smaller hospitals or the independent doctors. And so you saw CVS and Walgreens running around doing these vaccines. And then like Montana, they didn't use all the vaccines. So they sat on like 19,000 doses for over 30 days before they had to give them back to the government. So, moving forward, that stuff needs to go away. We saw insurance companies being a challenge as well with reimbursements, or they were creating their own rules where they were refusing to pay for the COVID vaccine. So we had a lot of battles with the insurance companies through the process. Conflicting direction from federal and state. You guys probably see this all the time where the feds are saying one thing and then you got the state coming in saying another thing. There was too much of that going on during the COVID pandemic. State laws. So with pharmacy, we have to have collaborative practice agreements basically for a lot of things we do. We were limited to 18 plus for age limits for who we can give vaccines. And we were not allowed to supervise nurses as pharmacists. And so a lot of the stuff that came out with the CARES Act allowed pharmacists to take on a larger role during the pandemic and do a lot more things. We can go to the next slide, please. And so a little history on me, just so you guys kind of aware, I'm a pharmacist for 14 years. I was born and raised here in Montana. Got a farm up on the High Line, got my pilot's license, CDL, and before 2020, I was actually a self-employed contract pharmacist where I traveled around doing a lot of Indian Health Service contracts, staffing at independent pharmacies, did some work for the corporations. And then when the pandemic hit, nobody wanted a contract pharmacist because we were contagious. We were traveling around spreading the disease. And so I took a directional shift with my career and saw the need for mass immunizations and started gearing up for that. So in 2020, I studied what they did with polio back in the 70s because that was the last true pandemic that we had to face. And so I studied what we did with polio. I kind of took that into consideration. And for me to open up a mobile vaccine service, the Board of Pharmacy in Montana required me to open a brick and mortar pharmacy. Again, more state red tape, but I did it anyway. So we have a full service pharmacy in Billings, Montana as a result of me moving forward with a mobile vaccine clinic. And so I started working on the software challenges, preparing for that. I pre-purchased a bunch of needles, gloves, alcohol swabs, and stockpiled those. And then the third thing I did is I kept it simple. So I didn't create a bunch of red tape for myself because there was already a lot of red tape out there. And in the fall of 2020, I actually, in the middle of the pandemic, I hit the road and I offered flu shots, shingle shots, tetanus shots, and pneumonia shots statewide to do a trial run to work out all the kinks with my software and stuff. So when the COVID vaccine became available, everything was very smooth. We can go to the next slide. So this is how I started out in 2020 is I took my Jeep and I bought a little trailer and everything went into that trailer and I went around Montana. Reynolds Market is a Montana-owned grocery store. They have 5 stores in eastern Montana. And I worked with them for locations to set up where we set up and offered vaccines that fall of 2020. We had a pretty good success. Every day I'd do anywhere from 100 to 120 shots easily without the COVID vaccine. And go to the next slide. So then as we saw that was successful, I upgraded to the short bus. So obviously we had a lot of fun with the short bus, driving around the state doing vaccines. We worked with breweries at that point where we started Get a Brew, Not the Flu. come in, get a vaccine, get a free beer. And as you can see, there's a lot of people in the background there. That's actually a small crowd from what we're used to with the COVID vaccine. And then this year, we can go to the next slide. This year, we upgraded to a semi-trailer. So since I have a CDL, I purchased this van trailer, and it's a complete walk-in where patients can get in out of the weather, the wind, do their paperwork, and then they move to the back of the trailer where they get their vaccine, and then they can exit the rear door there. And this is a very functional setup, and we haven't used it with a lot of people just yet. I just got it going this spring, but we'll hit the road this fall with this trailer. And we can go to the next slide. So partnerships was pretty key for me getting around Montana. Reynolds Market is one of my biggest partnerships on Eastern Montana. And as I mentioned, we partnered with breweries where we did Get a Brew, Not the Flu, and we'll do that again this fall. But we also did Get a Brew, Not COVID. And people love the slogans. It drew people out, and we get repeat customers with those events. Ford dealership, Bozeman Ford over in Bozeman, Montana, actually was one of the biggest turnouts we've had during the pandemic. They offered their building and their parking lot to us, and we did 260 vaccines in a 4-hour period in their parking lot. Long-term care facilities, assisted livings, and group homes. So then we started venturing out to these facilities and vaccinating those residents as well. And then health departments, like I mentioned, rural Montana health departments, they have maybe one nurse. It's a big undertaking for them to do this. So health departments started reaching out to us and working together on setting up community clinics. We can go to the next slide, please. So Farm 406, I'm not a big hospital. I'm not a big pharmacy, a very small staff. So on an average day during the pandemic, we have 7 to 10 employees at the pharmacy. We would operate like four staff members checking people in and doing the paperwork. And then we'd have maybe 2 or 3 shot givers where we could move anywhere from 250 to 500 patients through the pharmacy a day with that staff. When I'd go out and do my mobile clinics, it would be me and one other tech, or I'd take 2 techs with me. Basically, one tech would run the computer, one tech would draw up the syringes for me, and then I would administer those. When we were on mobile clinics, we could easily move probably, at the fastest was like 1 person a minute with the workflow. So we could easily move people through with the efficiency that we created. A lot of that goes back to my software. So a lot of places was all paper. So they were handwriting on the vaccine cards. They were having to manually go into the M-Track system and upload that. But my software was all digital. So it literally, we keyed in the patient information, hit the send button. All that data went into M-Tracks. It went into the insurance company, and then it spit out a label that we put on their vaccine card. So it was all digital. I reached out. So a lot of places were talking about hiring situations where they could not find anybody to do vaccine administration. But I found a bunch of retired nurses and pediatricians that kept their license, but they were retired. And they jumped up in joy being able to come back and be a part of this. So we worked out a schedule where they could come work 2-3 hours a day and give vaccines and be a part of the process and getting America back on their feet. And that's how I did it. And a lot of places struggled with that. But they were looking for full-time employees that wanted to work 40 hours a week. And these individuals didn't want to do that. The CARES Act from the federal government also allowed us to train and certify our pharmacy technicians to give vaccine. This is something that the state of Montana doesn't allow, but they're allowed to do it under the CARES Act. And it's something that our state in Montana and other states need to adopt into their state laws moving forward. Next slide, please. All right, so a big part of what I'm working on, and I'm trying to spread the word, is what did we learn during the pandemic and what can we write in stone and what can we move forward? Also, what did we do wrong that we don't want to do again? And we need to write this down because we don't know when the next pandemic will be. Will it be in 30 years where there's a whole new generation of healthcare providers? But we shouldn't have to recreate the wheel. And so the CARES Act, the CARES Act had a bunch of other acts with it, but we'll just call it all the CARES Act. It eliminated a lot of red tape, sped up the manufacturing and the delivery of a vaccine with Operation Warp Speed. It relaxed a lot of state laws that stood in the way of like pharmacists giving vaccines to 3-year-olds. So it allowed us to get out and vaccine children and pediatrics. And those things need to be adopted into the state level before the CARES Act expires. Again, use what's in place, don't recreate the wheel. We have a current distribution system, let's use it. Why are we using a different distribution system? We need to eliminate waste. So with COVID vaccine, we saw a lot of auxiliary supplies just being shipped out nationwide. There was a lot of waste there. I threw a lot away. I tried to donate as much as I could, but there was a lot of waste there. If we went to where the providers, had to purchase their own supplies, then that would probably eliminate a lot of waste there as well. Single dose syringes, everybody, would love single dose syringes. That would eliminate waste as well, make it a lot easier for providers. So as you know, Moderna 10-dose vials, Pfizer's in 6-dose vials. So if you don't have those patients there to use it within that window of time, you have to waste it. If we have a pandemic again, let's just plan on single dose syringes. Keep it simple. We need to level the playing field. So equal provider access, whether you're a health department, a pharmacy, a corporation, everybody should have equal access to the vaccine, the materials, and the supplies, equal reimbursements. So, I don't want to see like the corporations getting paid more than an independent pharmacy or the health departments getting higher FEMA funds versus an independent pharmacy that's out there doing stuff. And then we want to, just a second, obviously simplify the process. So MTRAX reporting, it was easy for us because we were able to do it digitally, but for facilities and stuff out there that have to manually sit down and pull up each patient, manually put in the lot number, the expiration date, left arm, right arm, that gets pretty tedious and pretty burdensome. So you find a lot of people just don't do it. So then that's why I'm there. They just call Kyle up and say, hey, Kyle, come out and take care of these vaccines for us because you make it so simple. Vaccine cards, do we need vaccine cards in the future or not? It seems like it was kind of a good idea, but they just kind of went by the wayside and really don't serve a purpose. We probably just need to go digital where there could be an app for everybody to download and everything's just digitally uploaded MTRAX, and then the patient just pulls their MTRAX on an app and get rid of the cards altogether. Health departments, I hate to say this, but I did run into a few health departments out there in Montana that like to be, they like to have turf wars, I guess I should say, where they didn't like me coming into their county and offering vaccines. And I kind of thought that was kind of, I don't know, disgruntled on my end, I guess. But I think health departments should be educational, not authoritative and non-competitive. They shouldn't be out there competing with people because we're all on the same team and we're there to get the shots in the arms. And so that's something moving forward that I'd like to see a change as well. Next slide. And I guess that's it. So if you guys have questions, feel free to email me at thefarm406@outlook.com, or you can call the pharmacy and leave a message. Our website is farm406.com. And again, we service Montana, but we're looking at servicing Wyoming as well here in the near future. So if you need to set up a vaccine clinic for your community or your facility, feel free to reach out to me. If you're struggling with logistics on, hey, how do we get software set up or something like that, that I can help out, feel free to reach out to me as well. And that's it. So I guess if anybody has questions or concerns, let me know. Thank you.
Thank you, Kyle. I appreciate it. Any questions or comments? All right. Well, and it looks like actually we're about close to time. So Crystal Morris, who was going to present on some infection control and cleaning processes, I think we'll go ahead and push that out to next time, just to be respectful of everyone that's on the call today. Again, any questions or comments? Barb says, thank you, great presentation, Kyle.
Thanks, Barb.
Getting a lot of thank yous. Kyle, do you have any input as far as how to address family vaccine hesitancy?
Um, a lot of it goes back to education. So one of my roles as a pharmacist and what I did is I never forced the vaccine. So I wasn't one of those people out there like, you have to get vaccinated, you need to get vaccinated. I sat back and basically said, hey, what concerns do you have with the vaccine that I can answer? It turns out a lot of people don't know what a vaccine is or what a vaccine actually does. And once I explain what a vaccine is and what a vaccine does and how it works, then they get a little more receptive. And a lot of time, probably about 30% of those people will get a vaccine at that time. If not, probably the other, oh gosh, probably another 40% of those would probably come back in the future and decide to get vaccinated once they just get comfortable. The families of obviously they care about their loved ones in the facility, and they don't want, they're probably on the fence where the vaccine is going to cause long-term damages to my family's health, or it's there to kill them so that they can't live any, all the stupid stuff out there on fake news. And I just educate them. It's like, well, you got your choice. You can take that risk, or if they don't get vaccinated and they get COVID, then they're going to get COVID and they're going to die. So do you want to take the risk of protecting them or take the risk of them dying anyway? And those conversations, seem to go pretty well, and they just need to be talked to, I guess, educated.
Right, right. Well, thank you, Kyle. We appreciate it. And the feedback, I see lots of thank yous in the chat box. And if any questions come up, we'll definitely refer them your way. And thank you so much for sharing your presentation. I certainly appreciate the evolution from a Jeep and a trailer to a semi. And I think that has had such a huge impact on our state. So we're extremely grateful.
Jesse, there's actually one more question if you want to fit it in real quick.
Oh, sure.
The question was, how do you handle refusals of boosters because it's the same vaccine as the initial doses?
Oh, good question. Kyle, can you help us on that one?
So I think it goes back to the choice. And so I kind of feel like the facilities will make their policies on what they want for the patients in their facilities. But on my standpoint, I go back to the choice. And so if they refuse the booster, then say, hey, you're making that choice. And the facilities might want that don't have it required, might want to have just a consent of refusal. Basically, they're accepting the risk of not being boosted and that there's a potential in the facility of getting COVID and being hospitalized and potentially dying, and just having that documentation. But again, it goes back to the facility policies. I mean, I've seen facilities that say, no, you're going to be updated on your vaccines regardless. And if you don't want that, I need you to find another facility because we don't want to be responsible. I've seen both of that out there. I guess that's up in the air. It's probably a facility to facility.
Okay. All right. Well, thank you, everyone. There is a survey link, as always, in the chat box. If you have a moment, please take some time and complete that for us. And until next time, next Wednesday, July 6th, happy 4th of July, everyone, and thanks for joining.